Jenny sat in a car outside the pharmacy holding a small orange bottle, feeling something close to hope. Buspirone. Her doctor promised it would help calm the racing thoughts that kept her awake at 2 in the morning, and the chest tightness her cardiologist had cleared her for. She had finally worked up the nerve to ask for help after months of telling herself it would pass on its own. But 3 weeks later, she poured the rest down the sink because she felt nothing. So she did what many people do in that moment. She decided she was the problem. She wasn't. And here is what no one told her. The pill in that bottle was never even designed to treat anxiety. It began as a failed schizophrenia drug. There are 3 reasons Buspirone does nothing for some people. Not one of them is your fault. Let me walk you through all 3. But first, remember that you're not broken even if the medications, therapy, supplements, and meditation have not worked for you. I'm Dr. Air, quadruple board certified psychiatrist. I've treated thousands of people who were handed this exact prescription and quietly concluded they had failed. Here's the part most doctors never explain. You were waiting for a feeling this pill was never going to give you. Most anxiety medications people know about work fast. You take a benzodiazepine, something like Xanax or Ativan, and within 20 minutes, you feel the calming effect. That speed comes from a brain system called GABA, your nervous system's brake pedal. Buspirone never touches that brake pedal. It works on a different system entirely, your serotonin 5-HT1A receptors. Picture it less like slamming on the brakes and more like slowly retuning an engine. That does not happen in 20 minutes. It does not happen overnight. One of the first major reviews of the drug by Goa and Ward in the journal Drugs in 1986 found it takes 1 to 2 weeks just to begin working, sometimes longer. So if you took it the way you take a Xanax, only on your worst days, it's not going to work. In 1991, a trial in psychopharmacology compared Buspirone head-to-head with the drug Xanax. The Xanax group felt better in the first week. The Buspirone group improved slowly over weeks, and far more of them quit early, certain it was useless. And if you're on a benzodiazepine before this, the deck was stacked even higher. The Rolling Stones sang about that world back in 1966, the quiet desperation of a woman holding everything together with a little helper. For decades, relief meant a pill you could feel within the hour. In a study of 735 patients by DeMartinis and colleagues in 2000, people coming off benzodiazepines responded worse to Buspirone and dropped out more often. Their brains were trained to expect instant calm. Buspar gives you nothing to feel on day one, so it reads as a failure. Here's the takeaway. If you judged this drug in the first week, you judged it before it had even started. But here's where it gets interesting. The second reason quietly ruins more results than anything else. Many of you were never really on the medication at all. In my practice, when someone tells me Buspar did nothing, I ask what dose they were on. Often, it was 5 milligrams once or twice a day, started by a busy primary care doctor. That is like dipping a toe in water. Such small doses won't do much for most people. And underneath the dose sits a stranger problem. Buspirone bioavailability is very low. A 1999 review in Clinical Pharmacokinetics found that only about 4% of what you swallow ever reaches your bloodstream. This extremely low bioavailability is due to your liver breaking it down as it passes through your system. It is not due to poor absorption. In fact, Buspirone is actually well absorbed from the gut. It just so happens that most of it is metabolized by enzymes in the liver before it enters the bloodstream. It is one of the least bioavailable medications in psychiatry. That is not a flaw in you. It's a quirk of the drug itself. 4%, and that number differs slightly from person to person. 2 people can take the identical pill and end up with completely different amounts in their blood. So when someone says it did nothing, the honest translation is sometimes this: I was barely on it and my body absorbed almost none of the little I was given. Here's the takeaway. Before you decide the medication failed you, it is worth knowing whether you were ever truly on a full dose of it. Now, it is important to point out that some people respond beautifully to this drug, and some don't. The third reason it doesn't work for some people is that it was prescribed for the wrong reason. Buspirone has evidence for one condition, generalized anxiety. That low all-day hum of worry that never fully switches off, the kind that follows you from the moment you wake up. If that is the type of anxiety you experience, this is the one the drug was actually studied for. A 2014 Cochrane review found it worked no better than a sugar pill for panic disorder. A 2017 Cochrane review found the same for social anxiety. So if your anxiety shows up as panic attacks or as dread before a meeting or a party, and someone reached for Buspar, it was set up to fail before you ever opened the bottle. It's like using the wrong key in the wrong lock. Now, very importantly, this next piece ties all three together. Why is one drug so easy to get wrong on timing, on dose, and on diagnosis? Because it was never built to be an anxiety drug in the first place. Buspirone was created back around the 1970s as an antipsychotic, a schizophrenia drug aimed at the brain chemical called dopamine. In testing, it failed. It did not treat psychosis, but the researchers noticed something strange. It quietly took the edge off anxiety, so they repurposed the remains of a failed experiment, and that became the calm little pill in Jenny's car. It is not necessarily a heavyweight medication, which is exactly why it tends to work best as a backup layered on top of an antidepressant rather than carrying your anxiety alone. Paired with an antidepressant, it finally has something to push against. On its own, it is a gentle nudge on a system that needed a much bigger push, at least for most people. The New England Journal of Medicine, in a 2015 review, treats it as a second-line or add-on option, never the front-line hero. Even when taken correctly, at an optimal dose for a full month, Buspirone is a modest medication at best. The largest analysis we have, published in the Lancet in 2019, pooled more than 25,000 patients and found that Buspirone does help, but ranks below options like escitalopram and venlafaxine. For some of you, no perfect dose will be the answer. It is one tool. It was never the measure of whether you can heal. So you may have been someone who was handed a quite modest tool, often dosed too low, barely bioavailable, and asked to carry a weight alone that it was never strong enough to lift by itself. Your nervous system was never the failure here. The plan around it was incomplete. And that is the real shift. A single pill was never going to calm a nervous system that has been stuck on high alert for deeper reasons. The complete approach, the one that reaches what a single medication can't, is what I build the nervous system reset around. The link is in the description below. Because here's what happened with Jenny. The problem was never that she failed her medication. It was that no one had checked what was actually driving the anxiety, the root cause. And when we finally looked, the answer was not in her head. It was one hormone her doctors hadn't bothered to check. That's what this next video talks about.